When a man crosses 60, his body does not work the same way it used to in his 30s or 40s. I want you to really understand this simple truth first. Even if someone looks active on the outside, inside the body things slow down. The liver, the kidneys, and even the blood flow all become a bit slower. And this is very important when we talk about medicines for the prostate. Now, many men at this age start facing prostate problems, things like weak urine flow, frequent trips to the bathroom at night, or feeling like the bladder is never fully empty. These symptoms are common, and yes, medicines are often used to help. But here is where most people get it wrong. They think one medicine fits all, or they think if it helped their friend, it will help them too. That is not true at all. After 60, even a normal dose of a prostate medicine can act stronger than expected. Why? Because the body cannot break it down as fast as before. So the medicine stays longer in the system. And when it stays longer, side effects also stay longer. This is something many people don't realize until they start feeling dizzy, weak, or not like themselves. Some prostate medicines relax the muscles in the prostate and bladder. That sounds good, right? But at the same time, they can also relax blood vessels in the body. When that happens, blood pressure can drop suddenly, especially when a person stands up quickly. Many older men don't connect the dots. They just think, I feel a little off today, or maybe I didn't sleep well. But in reality, it can be the medicine affecting their circulation. I have seen people who were fine in the morning, take their tablet, and then feel lightheaded in the afternoon. Some even feel like the room is spinning when they get up from bed or a chair. This is not just a small issue. A simple fall at this age can lead to serious injuries. Another important thing is that the body at 60 plus is usually already dealing with other changes. Maybe mild heart issues, maybe blood sugar problems, or joint pain. So when a prostate medicine is added on top of everything else, the balance becomes very delicate. It is like adding weight on a table that is already carrying too much. Even a small extra load can cause it to shake. Now listen carefully. I am not saying prostate medicines are bad. They can help many people. But the timing, the dose, and the choice matter a lot more after 60. What worked for someone at 50 may not be safe at 70. This is why regular review is so important. The same prescription should not just continue for years without checking again. Another thing people don't think about is how sensitive the body becomes to small changes. Even dehydration, skipping a meal, or taking another tablet for cold or pain can change how a prostate medicine works. So everything starts to interact in ways that are not always predictable. This is why I often tell families, especially when talking about older fathers, do not treat medicines like a permanent thing written in stone. Think of them more like something that needs tuning again and again. The body changes, so treatment must also change. I also want to say something very simple here. If someone after 60 starts a prostate medicine and then begins feeling new symptoms like tiredness, dizziness, or unusual weakness, it should never be ignored. It should be checked. Many times, a small adjustment is all that is needed. Maybe a lower dose, maybe a different timing, or sometimes even stopping it if it is not needed anymore. The biggest mistake is continuing something just because it was started years ago. That is where problems build up quietly. So when we talk about prostate medicines in older age, the main point is not fear. The main point is awareness. Know that the body is different now. Respect that change. And never assume that what is normal at 60 is the same as it was before. Because in medicine, especially in older age, small details make a big difference. And ignoring those small details can turn a helpful medicine into a risky one. Always think simple. Always review. And always listen to how the body responds, not just what the prescription says. Now I want to talk about something very important that many people ignore, but it can really affect daily life in a serious way. Some prostate medicines can cause a drop in blood pressure, and this is not always a slow or gentle change. Sometimes it happens quite quickly, especially in older men after 60. Let me explain it in a very simple way. Blood pressure is what keeps blood moving properly in your body. It helps you stand, walk, and stay steady. When it drops too much, even for a short time, you can feel weak, dizzy, or unbalanced. Now, many prostate medicines work by relaxing muscles in the prostate area. That helps with urine flow, so in that sense, they are useful. But the same relaxing effect can also affect blood vessels. When blood vessels relax more than needed, blood pressure can go down. This is where the problem starts. Most people do not feel anything right after taking the medicine. But after a while, when they stand up from bed or get up from a chair, they suddenly feel light in the head. Some describe it like a wave passing through them. Some feel like they might fall. And a few actually do fall. This is very common in older age because the body takes more time to adjust. A young body can balance blood pressure quickly. But after 60, that adjustment becomes slow. Now think about a simple daily situation. A person wakes up in the morning. He sits on the edge of the bed. Then he stands up quickly. At that moment, the blood needs to rush to the brain. But if blood pressure is already low, that flow becomes weak for a few seconds. And in those few seconds, dizziness can happen. This is what we call a sudden drop in pressure, and it is one of the hidden effects of some prostate medicines. Many people do not connect this feeling with the medicine. They think maybe they did not sleep well, or maybe they are just tired, so they ignore it. But when it repeats again and again, it becomes a real risk. I have seen cases where a person was perfectly fine sitting on a chair, but the moment he stood up, he lost balance. Even a small fall at this age is not small at all. It can lead to fractures, hospital visits, and long recovery times. Now there is another point here that is often missed. Older men are already more sensitive to dehydration. Even not drinking enough water can make blood pressure lower. When you combine that with a prostate medicine that also lowers pressure, the effect becomes stronger. And it does not stop there. Some people are also taking medicines for heart problems or sleeping issues. When all these medicines mix together, the body becomes even more sensitive. This is why I always say, it is not just about the prostate medicine alone. It is about the full picture of what the person is taking and how their body is responding. Another thing to understand is timing. Some prostate medicines are taken at night. That might sound fine, but it can increase the risk of dizziness when getting up at night to use the bathroom. And that is actually a very risky moment because the person is half awake, not fully steady, and the floor may even be dark. Many falls in older people happen exactly like this. Not during heavy activity, but during simple nighttime movements. So what should be done? First, never ignore dizziness, even if it feels small, even if it lasts only a few seconds. It is still a signal from the body. Second, always stand up slowly. Give your body a few seconds to adjust. Sit first, then stand. This simple habit can reduce risk a lot. Third, keep regular checkups. Because sometimes the dose that was fine 1 year ago may not be right anymore today. The body keeps changing, even if we don't notice it. And most importantly, never think of dizziness as normal aging. It is not something to just accept and live with. It is often a sign that something needs adjustment. So when we talk about prostate medicines and blood pressure, the main message is simple. The medicine may be helping one problem, but it should not create another risk in the process. Balance is the key here. And protecting stability while walking, standing, and moving in daily life becomes even more important after 60. Because staying safe is not only about treating a condition, it is also about preventing small risks from turning into big problems. Now let's talk about something that often gets missed completely, but it matters a lot more than people think. After 60, most men are not taking just one medicine. That is rarely the case. In real life, they are usually taking a mix. One for blood pressure, maybe one for sugar, sometimes something for cholesterol. And then the prostate medicine gets added on top of all this. And here is where things quietly become complicated. Each medicine on its own may look fine. But when you combine them, the body does not always respond in a simple way. It starts reacting differently, sometimes stronger, sometimes weaker, and sometimes in ways that are not expected at all. Let's take a very simple example. A man is taking medicine for blood pressure. That medicine is already lowering pressure to keep the heart safe. Now he starts a prostate medicine that also lowers blood pressure a little. On paper, both are doing their job. But in the body, the effect adds up. And suddenly the pressure can drop more than needed. Now add another layer. Many older men also take medicines for diabetes. Some of those medicines can also make a person feel weak or tired if the sugar drops too low. So now the body is dealing with pressure changes and sugar changes at the same time. It becomes a very sensitive balance. And this is the main issue. The body at this age is not as flexible as before. It cannot quickly adjust to changes the way it used to. So even a small mix of medicines can create bigger effects than expected. Another important point is timing. Most medicines are taken at different times of the day. One in the morning, one at night, sometimes even after meals. But the body does not separate them the way we do on paper. It processes them together in the background. So when 2 or 3 medicines overlap in their effect, the result can show up as dizziness, fatigue, low energy, or just feeling not right. And many people don't realize it could be the combination causing it. Now here is something I want you to really understand. Most older men trust each medicine individually. They think, this tablet is for my heart, this one is for sugar, this one is for prostate, so everything is fine. But the body is not reading labels. The body is only reacting to total effect, and that total effect is what matters. There is also another silent issue. Some over-the-counter medicines, like painkillers or cold medicines, are often added without thinking. These can also interfere with existing prescriptions. So now you have prescription medicines plus self-added medicines, all interacting together. This is where confusion starts inside the body. And sometimes the signs are very small, a bit more tired than usual, slight dizziness, mild confusion, or just not feeling steady. People often ignore these signs because they come slowly, not suddenly. But slow changes are actually more dangerous because they are easier to miss. Another thing that happens is that different doctors may prescribe different medicines without always seeing the full list. One doctor treats the heart, another treats sugar, another treats prostate. If the full picture is not reviewed together, overlaps can happen. This is why keeping a simple, updated list of all medicines is so important. Not in your head, but written down, so every doctor can see it clearly before adding anything new. Now let me be very honest here. The goal is not to stop medicines. The goal is not to create fear. Medicines are helpful and sometimes very necessary. But the goal is to make sure they are working together safely, not against each other. Because after 60, the body becomes like a sensitive system. Even small changes can have bigger effects than before. So every new medicine should be added carefully, and every old medicine should be reviewed again and again. And if something feels different after starting a new tablet, even if it feels small, it should not be ignored. It should be checked. Many times, the solution is simple: adjusting timing, changing dose, or removing one medicine that is no longer needed. So the key message here is simple. It is not just about one medicine working well. It is about all medicines working together in a safe balance inside the same body. And keeping that balance is what protects health in the long run. Now let's talk about something very common, but honestly very risky, and most people don't even notice it happening. Many men after 60 stay on the same prostate medicine for years, sometimes even 5, 10, or more. The problem is not that they are taking it. The problem is that nobody is stopping for a moment and asking, do you still need this at the same dose? And that question matters a lot, because the body at 60 is not the same body at 70 or 75. It keeps changing quietly. Kidney function slows down a bit. Liver processing becomes slower. Muscle strength reduces. Even hormone levels shift over time. So what was once the right dose can slowly become too strong, or sometimes not even needed anymore. But in real life, many people just continue the same medicine because it was started long ago. It becomes a routine. Wake up, take tablets, and move on. No review, no adjustment, just continuation. And that is where problems start to build quietly. Let me explain it in a simple way. Think of it like wearing the same size glasses for many years without checking your eyesight again. At first, it was perfect, but years later, your vision changes. Still, you keep wearing the same glasses. Slowly, things become unclear, but you think it is just aging. In reality, the prescription is no longer correct. Medicines can be the same way. Some prostate medicines are very helpful in the beginning. They improve urine flow, reduce discomfort, and make life easier. But after some time, the condition may change. The symptoms may become less, or the body may adapt. In some cases, the medicine may not even be needed in the same strength anymore. But without a proper review, nobody knows this. Now, here is something important. When a medicine is taken for a long time, the body also adapts to it. That means side effects can slowly build up without people noticing clearly. It is not always sudden. It is slow, very slow. So slow that people think it is just normal aging. Things like low energy, mild dizziness, weaker focus, or just feeling not as fresh as before are often ignored. People say, "I am getting old, that's why." But sometimes it is not just age. It is the medicine still running at the same level when the body has already changed. Another problem is that sometimes the original reason for starting the medicine is no longer strong. Maybe the prostate condition has improved. Maybe symptoms have become mild, or maybe lifestyle changes have helped. But the medicine is still continuing just out of habit. And habit is a powerful thing. It feels safe because it is familiar. People trust what they have been taking for years. They don't want to question it. But in health, especially after 60, questioning is not disrespect. It is protection. There is also another important angle. When medicines are not reviewed, small issues can turn into long-term problems. For example, a slightly high dose continuing for years can slowly affect balance, energy, or even increase fall risk. But because it happens slowly, it does not feel connected to the medicine at all. It just feels like getting older. Now let me say this very clearly. A medicine is not meant to be permanent by default. It is meant to be useful for a specific time, in a specific dose, for a specific need. And as the body changes, the medicine plan should also change. This is why regular checkups are so important. Not just for testing, but for reviewing everything. What is still needed, what can be reduced, and what can be stopped safely. Sometimes even a small change makes a big difference. A lower dose can improve energy. Adjusting timing can reduce side effects. And in some cases, stopping a medicine that is no longer needed can make the person feel more stable again. But this only happens when someone takes time to review. Without review, the body carries unnecessary load for years, and that is something many people don't realize until much later. So the message here is simple. Do not let old prescriptions run on autopilot. Do not assume that what was right before is still right now. The body is not frozen in time. It keeps changing, and treatment should change with it. Because good care is not just about starting treatment. It is also about knowing when to adjust it and when to simplify it. And sometimes the smartest move is not adding more. It is stepping back and asking if everything still belongs there. That is how you protect long-term health in a real way. Now let's talk about something many people don't connect with medicines at all, but it is actually very real. Some prostate medicines can slowly affect how a person feels in daily life. Not in a dramatic way, not something that happens in one day, but in small steps, day by day, until the person starts feeling a bit different and cannot clearly explain why. And this is where it becomes tricky, because when changes are slow, people don't link them to the medicine. They think it is just age, or just stress, or just normal tiredness. But sometimes, the medicine is part of that picture. Let me explain it simply. After 60, energy levels are already not the same as before. That is normal. But when certain medicines are added, some people may notice they feel more tired than expected. Not sleepy tired, but low energy tired. Like the body is moving slower than the mind. A man may wake up in the morning but still feel like he has not fully woken up inside. He may do his daily work, but feel like everything takes a little more effort. Even small tasks feel heavier than before. Now, this does not happen to everyone, but when it does happen, it is often ignored. People usually say, it's just age. And yes, age plays a role. But we should also look deeper when something changes after starting a new medicine or increasing a dose. Another thing that can happen is mild mood change. Not depression in a strong sense, but a subtle shift. A person may become less active in conversations, less interested in hobbies, less excited about things that used to feel normal. Family members sometimes notice it first. They may say, he is not as active as before, but they cannot point to a clear reason. And the person himself may not even realize it. This is very common because these changes are slow and soft. They don't come like a sudden illness. They come like a slow fading of energy and interest. Now, let's be very clear here. This does not mean every prostate medicine causes these issues. That is not the point. The point is that some men can be more sensitive to them, especially after 60, and especially when there are other health conditions or other medicines involved. Another effect that sometimes shows up is reduced focus. A person may feel a bit more forgetful or slower in thinking. Not serious confusion, but a kind of mental fog. Things like forgetting small tasks, losing attention while talking, or feeling mentally slower in the afternoon. Again, this is often blamed on aging. And yes, aging does affect memory and focus. But when changes start after a new medicine or dose adjustment, it is worth paying attention. Because quality of life is not just about living longer. It is about feeling steady, active, and mentally clear in daily life. Now I want to say something very simple but important. Many people tolerate these changes quietly. They don't complain, they don't mention it to doctors, they just adjust their life around it. They reduce activity, they rest more, they slow down. And slowly, their world becomes smaller, without them even realizing it. That is the hidden part. The medicine may be helping one problem, but if it is slowly affecting energy, mood, or mental sharpness, then that balance needs to be checked. Because the goal of treatment is not only to fix urine flow or prostate symptoms. The goal is also to protect daily quality of life. Another important point is that sometimes these effects can improve simply by adjusting the treatment, not always stopping it. Sometimes just changing the dose or timing can make a difference. In some cases, switching to another option helps. But this only happens when the change is noticed and discussed. If no one talks about it, it continues quietly in the background. So I always tell people, pay attention to how you feel after starting or continuing long-term medicines. Not just the main symptom, but your overall energy, mood, and clarity. Because your body always gives signals. They may be small, but they are real. And ignoring those signals for too long can slowly affect how you live each day. So the key message here is simple. Health is not just about treating one condition. It is about keeping the whole person feeling balanced, active, and clear in mind and body. And if something feels different, even in a small way, it deserves attention, not silence. Because small changes today can shape how you feel tomorrow. And protecting that balance is just as important as treating the condition itself. Now finally, let's bring everything together in a simple and practical way. After 60, prostate medicines are not something you just start and forget. They are not set and done. The body keeps changing, so the treatment also needs to be checked again and again. This is why regular checkups are so important. Not just a quick visit, but a proper review of what is actually happening inside the body. Let me explain it in a very simple way. Think of your health like a road trip. At the start, you choose a route. But along the way, roads change. Traffic changes. Conditions change. If you keep driving without checking maps again, you might still move forward, but not in the best direction. Medicine works the same way. A prostate medicine that was perfect 2 years ago may not be the best choice today, or maybe the dose is too strong now, or maybe it is still fine, but needs timing adjustment. You don't know this unless you check. Now, one of the biggest problems I see is this. Many people think, I am already taking medicine, so I am fine. But medicine is not the final step. It is just part of care. The real safety comes from follow-up, because follow-up is where you catch small issues before they become big. During a checkup, a doctor should not only ask about urine symptoms. That is only one part. They should also ask how the person is feeling overall. Energy level, sleep quality, dizziness, mood, daily activity. These small things matter a lot. Sometimes a man will say, urine is fine, but I feel weak. Or, I am okay, but I don't feel like myself. These are very important signs. They should not be ignored. And sometimes the solution is very simple. A small dose change. Or stopping one medicine that is no longer needed. Or switching timing from morning to night, or vice versa. Small changes can bring big improvement. Now let's talk about something very practical. It is a good habit to keep a simple list of all medicines. Not in memory, but written on paper or phone. Every tablet, every dose, every timing. And take it to every doctor visit. This avoids confusion, because sometimes one doctor does not know what another doctor has already prescribed, and that is how overlap happens. When everything is in front of you clearly, decisions become safer. Another important point is not to assume that feeling okay means everything is perfect. Many side effects are silent, they don't shout, they whisper. So a person may feel normal, but still be slightly more tired than before, or slightly less steady, or slightly less sharp. And over time, these small changes add up. That is why regular review is not only for problems, it is also for prevention. It helps you stay ahead, not behind. Now, I also want to say something very honest. Sometimes people avoid checkups because they feel everything is fine, or they don't want to change anything. Change feels uncomfortable. But in health, avoiding change can sometimes create bigger problems later. A simple review once or twice a year can prevent years of silent issues. And this is not about fear. It is about control. You stay in control of your health instead of letting things run on autopilot. Also, family plays an important role here. Sometimes a family member notices small changes before the person himself does. Things like slower walking, less energy, or more tiredness. These observations are valuable. They should be shared during checkups, because health is not managed alone. It is a shared responsibility. Now, let's bring it to the main idea. Prostate medicines are useful. They can improve life a lot, but they are not meant to be ignored after starting. They need care, attention, and regular review, just like any other important part of health. And when that review happens properly, many problems can be avoided before they even start. So the message is simple. Don't just take medicine. Understand it, review it, adjust it when needed, and always make sure it still fits your body today, not the body you had years ago. Because real healthcare is not about just continuing treatment. It is about making sure that treatment still makes your life better every single day. And that is what truly keeps a person safe and steady in the long run.